So let's learn what macular degeneration is from today's guest ophthalmologist, Dr. Natasha Herz.
Well, to understand that, you really should talk about the anatomy of the eye first. And the inside of the eye is lined with a thin layer of nerve tissue called the retina. And the very central part of that retina, which is right behind the pupil, so that's where the first things that you see are focused, is called the macula. So that specialized portion of the retina, if it starts to die off over time, is called macular degeneration.
And are there different types of macular degeneration?
There are. Dry and wet are kind of the common terms for that. It means, though, that the dry type, there isn't any bleeding involved. Whereas if it turns into the wet type, that means that there's abnormal blood vessels that have also started to grow under the macula, and those can break and bleed, and that sometimes can happen overnight. So the wet kind, it's much less common, but it's the worst kind to have.
So how do you treat it?
So with the dry kind, if you're in the early stages of it, the mild stages, then there's not really any medication that you can either put in the eye or eye drops or anything like that, nothing prescription-wise. But there was a big study that was done by the National Institutes of Health between 1992 and 2006, where they tried a certain formulation of high doses of antioxidants such as vitamin C and vitamin E, and beta-carotene, as well as some zinc. And in that formulation tested to see if that would help to slow down the progression of the dry kind. And they discovered it didn't really make much difference either in the arm of the study where they didn't have any sign of it, or if they had just mild signs of it. But if they had intermediate disease, it did slow down that progression to advanced disease by about 25% over 5 years. So even though it's not a cure, it at least is something that they can slow it down with, even because there's not really anything else that you can do. Well, I'm sorry, that's not right. If you can stop smoking too, along with the antioxidant vitamins.
All right. Now for the wet kind, if you've got bleeding, is there anything you can do? Do you laser, anything?
So for the wet kind, it used to be that they would laser the area that was bleeding to stop the bleeding, and it did stop the bleeding, at least in that area, but it also killed all the tissue in that area and left them with a big blind spot. And so some people were asking, is the treatment worse than the disease? And fortunately, 10 years ago, about 2004, they came out with a medication that if you inject it in the eye, which I know sounds terrible, but if you inject it in the eye, it will shrink those abnormal blood vessels so that if you catch them early enough, you can stop them from breaking and bleeding and taking the vision. And so that's really revolutionized the treatment of the wet kind.
Right. How often do those injections need to be done? Is it a once?
So
it doesn't sound very pleasant.
So that is another area of improvement that they're looking to change. At this point, the medicines last about 4 to 6 weeks, and depending on the person, you know, if it keeps coming back, they have to keep doing the injections that often.
Oh, that's tough.
But because of how miraculous they are, really, people will do it. I mean, it saves their vision. I had a dear lady who only had one good eye, the other eye that just never really worked well, even from birth. And she unfortunately one day woke up and all of a sudden her vision was gone. She came in, it was the wet kind, and she got the treatment, the injection done within a day or two of seeing me, and she got her vision back. I mean, she's able, she's not 20/20, but she's 20/30, she's able to drive. I mean, it made a huge difference for her.
Oh yeah, that's life-changing. So what are the risk factors for macular degeneration?
Number 1 is still age. Number 2 is smoking. And then beyond that, there is also a correlation to ethnicity with macular degeneration, with it being much more common in Caucasians. And that is, especially in people that are 65 and older, although you can see the beginning signs even in 40 to 50 range.
Perhaps during your 40s you've seen an optician for reading glasses, but once you hit 50, that's not enough. When it comes to protecting our vision, regular checkups are vital. You may have no symptoms or any family history, but remember what Dr. Herz said, you can't see what you can't see. So find out what you can't see before it's too late. And though vision deteriorates with age, you can do many things to slow it down. Like eating plenty of veggies and berries, the more colour, the better. When it comes to fat, choose healthy fats like avocados, nuts and seeds. And whatever you do, don't smoke. That's all from me today. Thanks for joining us on Go Healthy for Good. I'll see you next time.